Welcome to the special Wednesday, March 4th meeting of the Washington County Board of Commissioners.
The Board of County Commissioners of Washington County, also serving as the governing body of clean water services in all other county service districts, is now meeting in special session March 4th, 2020. Commissioner Willie?
Here.
Commissioner Treese?
Here.
Vice Chair Skoughton?
Here.
Chair Harrington?
Here.
Thank you.
Good afternoon, everyone. We're hoping to have Commissioner Rogers participate in this special meeting, and in doing so, he would be participating via the telephone. So our order of logistics here may be a little bit cumbersome as we get that all set up, but stay tuned. We'll see how it goes. The first item on today's agenda is oral communication. I don't currently have anyone signed up to speak at this time. Is that right, Barbara?
That is correct. I'm just going to bring up a 5-minute sign-in sheet.
Okay, for later in the agenda. Thank you. The second item on our agenda is the consent agenda. We do not have a consent agenda for today. So the next item on our agenda is an action item related to Health and Human Services to declare an emergency related to COVID-19. So what we'll be doing on this is, for this resolution in order, we will have a staff report, and for that staff report, we will be hearing from 3 people. Dr. Bauman, our public health officer, followed by our legal counsel, Mr. Alan Rapplier, then followed by our manager for the Emergency Management Operations Center here in Washington County, John Wheeler. So let's kick this off then and start our staff report with Dr. Bauman.
Yes, thank you, Chair and Commissioners. I am starting out with a situation report about what brings us here today. So on Friday, February 8th, we learned that the first individual to be diagnosed in Oregon with novel coronavirus, or otherwise known as COVID-19, is a Washington County resident, hospitalized at Kaiser Westside Hospital. There is no known connection to travel or other persons with diagnosed COVID-19. On Sunday, March 1st, a second Washington County resident was diagnosed with COVID-19 after they were identified in the public health investigation. The following day, Umatilla County announced that a resident is the third diagnosed case in Oregon. This person also did not have any known connections to travel to affected areas or known cases. As a result, we believe that we now have community spread of COVID-19, otherwise known as novel coronavirus. This news is, of course, concerning that this disease has reached so close to home. Washington County Public Health and our other public health partners and healthcare partners have been preparing for this development. We have strong relationships between each other, with the Oregon Health Authority, and our healthcare providers in the community. We've responded quickly, initiating a public health investigation and control measures, expanding our capacity to meet the needs of the public and our providers for information and guidance, and communicating health information and education on how to prevent spread and stay healthy. We will do our part to keep our community healthy, and we are also asking our community to do their part. There are very basic infection prevention things that people can do. They have been tried and true. They work for coronavirus, they work for the flu, they work for other diseases. These are stay home if you are sick. This is key to preventing spread. We also ask that people wash their hands. This can prevent illness and keep it from spreading. And cover your cough so that other people around you can stay healthy. So with that, I want to turn to Alan Rapplier with next.
So what I'm here to talk about is the declaration itself and what it does and what it doesn't do. Just as a matter of clarification, this is an emergency we're declaring for a health hazard as the situation Dr. Baumann described, but it is not a public health emergency. That is a term of art in the statutes, and the state of Oregon gets to declare that. We are declaring an emergency because of a health reason. So the resolution before you, again, lists the reasons why we're declaring it, and then it invokes the powers of our county code 8.36 in our adopted code, and that it has broad sweeping powers. The way we worded this, though, is we are just implementing the health emergency protocols. We're asking for assistance, but we're not really specifically asking for those powers that are listed in the ordinance. And I'll describe those powers, and if needs be, we can come back and then change that and add any specific direction that you give us. So some of those powers are including but not limited to. So we have, broad powers: curfew and limiting businesses, evacuation of areas, limiting gatherings, closing roads, regulating purchases of products, and changing our personnel and our purchasing rules, and limiting commercial activity. Again, we're not invoking any of these now, but I just want to know that those are some of the broad powers you have under the emergency ordinance, and that if needs be, we can always come back and get further direction. And then I'll turn it over to Mr. Wheeler, who talks about their Emergency Operations Center.
Great, thanks, Alan. So I'm John Wheeler, Interim Program Manager for Washington County Emergency Management. Yesterday at 2 p.m., we activated the Washington County Emergency Operations Center. The EOC, for the uninitiated, is the central facility where county staff and other critical partners will convene to coordinate resources, information, and decisions. Resources to support entities like public health and others, coordinate critical decisions, and provide, very importantly, provide information within the county organization to the public and to our stakeholders around the county. Most importantly, we also are there to unify the response of the county and of the county stakeholders to make sure that we don't have silos or stovepipes, that we have a unified, coordinated effort within Washington County and amongst all of our partners around the county. We are activated currently at what we call a partial activation, which means we really just have a handful of people in the EOC. We are ready to expand that operation if we need to. Our current objectives are really to focus on providing information and resource support to the disease control operations, and of course also to coordinate the public information mission both within the county, amongst our partners, and with the general public as well. So with that, are there any questions?
Well, I know I have a few questions. Okay, so right now we're going to dial in Commissioner Rogers.
Hello.
Hello, Commissioner Rogers. This is Chuck with IT. We're ready to get you in.
Thank you.
So Commissioner Rogers, this is Chair Harrington. We've had the opportunity of a staff report from Dr. Baumann, our public health officer, from our county counsel, Alan Rapplier, about the declaration as well as the parameters of County Code Chapter 8.36, as well as a report from John Wheeler, our Emergency Management Operations Center Manager. And we're just about to start questions. But before we go into questions, do you wish us to have that staff report repeated for you?
No, I don't think so. The only questions I had was I understand that it allows to do not follow public purchasing rules on emergency cases. I'm not certain what the broad, the resolution, how broad are the parameters that we have? It seems to be pretty.
Commissioner Rogers, this is Alan Rapplier, County Council. They are broad in invoking the emergency, but they are limited in what powers we're actually invoking. There's a whole list of sweeping powers that are under the ordinance, and we are not invoking any of those yet. If need be, we'll come back to the board and seek guidance on those.
So as
Yeah.
if I might, as I've read the updated declaration as posted on our website, we have, be it resolved that we are empowering the emergency program manager to coordinate response and recovery, not limited to the potential reimbursements from the state and federal agencies. We're also invoking that part of the code chapter and ORS for emergency procurement of goods and services, and have set the expiration date of March 18th. What we have not invoked yet are powers that Mr. Rapplier had summarized earlier, such as restrictions on large gatherings, closure of roads, and other aspects that are called out in the code. Have I summarized that correctly?
Madam Chair, yes, that's correct.
Okay.
Thank you.
Do you have any other questions at this time before we take questions from the dais?
I don't think so. I was just with a bunch of large employers, and they were they're concerned about the. I know we'll do a good job of making certain people are not panicking about something they don't need to be.
Yep, so what we'll do is we'll take questions from the dais up here, and I will ping you again to see if you have other questions before we close discussion and questions and take any motion. Is that okay?
Perfect. Thank you so much.
Okay, so questions from the dais from anyone, and I'm more than happy to start if you'd like. Or
Well, I have one question. Actually, I have two. So it's my understanding that by voting for this, we are providing ourselves the opportunity to receive federal funding in relationship to managing this situation. Is that correct?
Mr. Treese, members of the board, yes, that is correct. That's one of the main purposes.
And the other question I have is, can you tell me what the process is? You said you would come back to the board if we were to invoke any of the other more extensive actions. What does that mean when you say come back to the board?
Well, this motion, the resolution expires in 14 days, so if this continues beyond that, we will definitely come back, and we expect to come back. And we would come back with specific written resolution that include those requests we have to have you consider. So if we considered closing a road, we would put that specific power on there and have you.
And that would require a vote of the board, is that correct?
That is correct.
Thank you.
We have succession planning in case there is no board, but yes, typically we expect to come back.
Thank you.
During that time between now and the 18th, if it seems like the situation has changed such that our experts are recommending that we limit large events, would you come back to us and ask us to invoke that power?
Madam Chair, members of the board, yes, exactly. Just like we had an emergency meeting today, we would have an emergency meeting again and ask for a direction.
Okay. Any other questions, Commissioner Treese, at this time?
Quick question, just in terms of notice, how much notice required?
The public meetings law requires notice that is deemed reasonable, and again, this is an emergency situation, so it's whatever the board deems reasonable, and we stood this up rather quickly because of the emergency situation. So I think that what the board considers an emergency would be unlikely to be second-guessed by our members of our judiciary.
In this case, I was striving for 24 hours. We put notification up on our website 24 hours ago, and then got the resolution up there as well. I have a couple of questions, if I might. I appreciate the advice that we've gotten from our public health team and that our staff has put out via our website with links, as well as the public health Facebook page for Washington County. And you've been very clear about what precautions help in this situation. The staying home if you're sick, washing of hands, and covering your cough, things like that. Very practical solutions. Thank you. It's been very interesting to read national press about this evolving situation, and particularly the guidance about how we community members can help the situation, particularly for those who are more vulnerable in this situation that we find ourselves in with COVID-19, particularly for the elderly and those with underlying health conditions. I also appreciate the guidance about social distancing. I have a cold right now, and so I'm trying to be very practical about not being too close to folks and sharing my germs. I appreciate the clarification on the large gathering. What I have seen through social media and local press is some frustration from members of our community about what to do. And so I want to ask a couple of questions so that Dr. Bauman, you and your public health colleagues have the opportunity of giving us and the public through this broadcast the reasonable advice that you can give. And I have two particular cases. So really, it's a question of, for each of these two groups I'm going to mention, to help us understand, what do you want people to do? And the two cases are those who have traveled and just returned recently from countries where the COVID outbreak has been a bit earlier than here in the States. And I read an article about a Beaverton couple who is just back from South Korea and have self-quarantined themselves, and I think that's admirable. And then the second group is, what do you want people to do in the category of those who are experiencing flu-like symptoms?
Right. So thank you for those questions. The first question, I would say there's changing guidance from the CDC on this, especially as different countries have more elevated travel advisories to them. So the basic advice, the underlying rationale is that if you develop any symptoms of illness, stay home. If you need to seek care, call ahead to your healthcare provider so that they can prepare to see you and screen you as they need to be able to see you safely. And otherwise, there are some recommendations right now that to home isolate if you can, or rather home quarantine if you can, once you've come back from the travel for 14 days in case you were to develop any symptoms. So we use those terms, isolate and quarantine. I think it's worthwhile to perhaps go over the definitions, because even I myself slip back and forth between the two. So to isolate separates sick people who have a contagious infection from people who are well, okay? So if you develop symptoms and you stay home, you are isolating. And quarantine separates and restricts the movement of people who were exposed to an infection to see if they become sick. So I guess we should use the term, you come back from travel, you're feeling well, and if you're staying at home, you're essentially home quarantining. So those are certainly measures that people can take if they're able. They are voluntary right now as far as the CD guidance goes, and we expect that that guidance will change as the situation changes globally and in our community as well. So the next question you had was what to do if you have flu-like illness. I think the most common sense approach is, like I said before, stay home if you're sick. I know people have concerns that their illness might be due to coronavirus. As the situation changes in our community, if we have more cases, that could be a stronger possibility. However, there is a spectrum of illness, a range of illness. We know that a large majority of coronavirus infections are mild. People do not get that sick. Of course, we have seen examples of where people do get severely ill. So what we need to be conscientious of as community members is not to overwhelm our healthcare system. There is no treatment, and there wouldn't be any treatment for mild symptoms. We advise that people stay home if they're ill for the main purpose of not spreading it to the rest of the community. If you are ill enough to need to seek care, like you usually would for another condition, then do so. And warn your provider if you have any direct connections, say through travel, that might increase the likelihood that it's coronavirus. We really want to make sure that our healthcare providers can treat people and have the capacity to treat people in the room in their emergency departments so that people who are severely ill can get the care that they need in a timely fashion.
If I might follow up, I'm concerned that there are some folks who may think that if they come down with flu-like symptoms, that they should automatically get tested. And it's been interesting to read just today, just this morning, I read information on the national press that the CDC was perhaps sending mixed signals about getting tested or has loosened their protocols on testing recommendations. So I'm wondering, at this point in time, as our public health official here in Washington County, what is the best available information about that? Is it just following the advice that you just gave us? Or how are people to know if they need to request testing or not?
Yeah, so the advice that I gave is really the advice that public health is given here in the local level and at the state level. That is our best advice. And as we know, the situation has been changing, and I've been saying that a lot, and the CDC has to change to keep up with what's happening and to modify their testing criteria in conjunction with what's happening. So today, the CDC did, again, modify their testing criteria. That is more for providers to be able to test in the context of what's happening where they are, meaning that in areas where there is community spread or there are infections happening that aren't tied to travel, those providers should have the ability to then obtain a test. And the testing is really recommended for people who are severely ill, where that knowledge would actually change the type of treatment that they would receive. In general, for people who have mild symptoms, as we know, many of these coronavirus infections will present with mild symptoms or will have mild symptoms. The best advice is the infection prevention advice to keep it from spreading in the community.
Could I
Thank
ask
you. That takes care of my questions.
Could I ask you to define what severely ill means? I know that sounds silly, but is it like a temperature that is above 100 for X number of days, or is it, you're incapacitated? Could you help with that?
Yeah, absolutely. And I would say that judgment is probably best made by the provider because there are many different things that could factor into severe illness. It wouldn't just be a temperature of a certain amount. It would be that people are in a state where they need medical help and attention. So, and the term severe usually means that it's an emergency department. That's the appropriate place for people to be seen rather than people who are feeling okay and might be able to take care of themselves at home.
Question for you. I've heard from various sources that as they're looking at those situations in China where there's very severe symptoms or death, that there's some correlation between that and smoking. Could you comment on that? Is that true? And that would make sense because that's the only way that you compromise your respiratory system. If you heard anything about that or comment on that?
Yeah, so there are, they have been looking at what conditions are associated with having a more severe illness. And in that, other underlying conditions like heart conditions and lung conditions, diabetes, immunocompromise, do increase the chances that people could have more complications from the infection. And smoking, I think you're right in saying that does compromise your lung function and can lead to lung disease. So that is a likely tie.
There are no other questions from commissioners here on the dais. Commissioner Rogers, do you have any other questions?
I do not. Thank you.
Is there anything else that the three of you would like to add at this point? Okay, seeing none, what are the wishes of the commission with regard to this resolution and order?
Madam Chair, I move that we declare emergency for 14 days under Washington County's Code, Chapter 8.36, to support response activities to COVID-19.
Second.
We have a motion and a second. All those in favor, please vote by saying aye. Aye.
Aye.
Any opposed? The motion passes unanimously, 5-0. The next item on the agenda is oral communications. This is an opportunity for anyone to come and testify on any subject for up to 5 minutes. We have one person who has signed up, Mr. Dale Feek.
Thank you for your help on that.
Yes, thank you to our public health group.
Yes, best wishes to our staff in the days ahead dealing with this evolving situation. And thank you for putting this meeting together. Mr. Feek, would please proceed?
Thank you, Madam Chair Catherine Harrington, Commissioner Jerry Willey, District 4, my commissioner, and Commissioners Pam Treese, Dick Scouten, and and Roy Rogers, who's coming through the internet or something. I'm Dale Feek, resident of Washington County since 1966, project director of Hillsborough and Water, and chair of Washington County Citizen Action Network. The emergency has impacted my travels. I was scheduled to attend the Public Interest Educational Law Conference in Eugene, March 5th through 9th. That was canceled. I'm really disappointed because I've been in communication with Robert Billett, who is the attorney that sued DuPont, and he and I were going to meet in Eugene because he was going to show the film Dark Waters and sign his books. I'm sure we'll have an opportunity to do that at another time. But so this has impacted me personally, and also the people that were scheduled to present, and also the people that were going to go to that conference. I'm pleased to let you know that Holly Duncan, who had worked for DEQ and worked with Baumgartner when she was a DEQ employee, she has not canceled her conference, and that's going to be March 11th. It's a Superfund 20 conference, and in what I've given you, there is a hot topics, and the hot topics are the PFAS perfluorinated chemicals. So there'll be at least 3 presentations there, and I will be going to that conference on March 11th unless I'm notified otherwise. I do have an update on Bonita Packaging, and I did make a couple spelling mistakes. I tried to correct them in your written copy. your email copy will be incorrect in that sense. Because I've talked with a few people, I can't remember whom, about the 30 worst industrial air polluters in Washington County, Hillsborough Airport being one because of the lead, Bonita Packaging number 2, Intel number 3, Stimson number 4, and it goes all the way into Banks, 30, Banks Lumber Company. And attached to the first email that I sent you related to this, I did note that Bonita Packaging, that's for Commissioner Rogers, because that's in your district, number 2. And the data that this is taken from was 2017 data. DEQ requested by Pete Shepard, I guess it is. Pete Shepard is the interim director of DEQ. He's the one that requested it just before he left. And I was told by Matt Hoffman, who is a supervisor of air permit writers, that most industrial polluters will err on the side of saying they have too many emissions. Because if they don't do that and they get caught, their fines are very heavy. And their fines are not heavy if they overestimate the amount of emissions they have. And so, on average, the emissions will be more than what they actually put out. I mean, that's a fact, I think. But not always. For instance, Intel, when they get their $2-3 billion manufacturing plants going, may end up getting up to their potential to emit emissions. Also, Commissioner Rogers, I didn't notice, but you have quite a, you have number 6, 9, 12, 15, 22, 23, 25, 28 that are in your district over there. So you're not immune from the toxic air emissions in Washington County. The point, though, I'm trying to make is Cleaner Air Oregon is working. It's working because Bonita went out of business. And I think they went out of business because they realized that they didn't want to initiate their controls to control their emissions, so they sold that part of the business. So that problem in your district, Commissioner Rogers, may be eliminated. The second part of my public comment has to do with the race equity resolution, and I gave you a separate email on that. I'll have to apologize because I was kind of pressed for time and I got some more errors in that than I want. But I just want to say thank you for passing that resolution unanimously. And I will update this because I'm sending it to all the people that I have email addresses to that made public comment. And so I need to get those addresses because they can get on TV, WTV, and watch the public comment and watch your deliberation at the dais. And so I will get that out as more of a corrected document. Thank you.
Thank you. The next item on our agenda is board announcements. We will be having our scheduled meeting tomorrow, Thursday, roundtable, starting at 9 in the morning, and then our next set of meetings, next Tuesday, March 10th, we have an extended work session starting at 8:30 in the morning. And the following Tuesday, March 17th, we have a work session at 8 in the morning and a board meeting at 10 a.m. All this is posted on the county website, so I would call your attention to that. Are there any other board announcements? Seeing none here, Mr. Rogers, do you have any announcements? Commissioner Rogers?
I do not, thank you.
Okay. With that, do we have a motion to adjourn?
So moved. Second.
We have a motion and a second to adjourn the meeting of Wednesday, March 4th, 2020. All those in favor, please vote by saying aye. Aye. Any opposed? Motion passes unanimously, 5-0. Goodbye, everyone. Thank you.